In March 2020, the world and Needham came to a screeching halt. But while nothing was moving outside, we were all struggling inside. Struggling with uncertainty, struggling with anxiety, struggling with fear. But from despair comes hope, and you chose optimism as the cure. You colored your driveways and sidewalks. You hung signs and inflated cheer. You turned your lights on for us, and we left ours on for you. You poured your hearts out for us. You held benefit concerts for us. You knit masks and surgical caps. We lifted each other up because we know that we are stronger together. So while things were a little quieter on the outside, inside these walls we did not sit idle. We remained vigilant, navigating complexities as we adapted to our new normal. We are here for you each and every day and night, as we have been for more than 100 years. Now it's our turn to say thank you, as you were there for us. You wrote us thoughtful letters. You donated gift cards to provide a morale boost to our staff who are focused on the mission at hand. You printed 3D masks. You held fundraisers for us. You donated parking, food, PPE, and over $250,000 from 317 households to support our healthcare heroes. First responders circled our hospital with a parade. Our community members also organized a parade. Even dinosaurs came back from prehistoric times to show their appreciation for our staff. You provided new sneakers to all of our frontline workers. You gave over 15,000 free meals to our staff, supporting local restaurants along the way. Rain or shine, you clapped because you care. And while the pandemic is not over, with many challenges and unknowns ahead, just know that we will always be here for you. Now it's our turn to clap for you. In times of uncertainty, we are stronger together.
Hello and good evening, everyone. I'm thrilled to be here tonight on behalf of WCVB Channel 5 to host this virtual event, Stronger Together, in support of BID Needham's Healthcare Heroes Fund. I'd like to thank WCVB Channel 5, tonight's media sponsor, for making the support of essential community partners like BID Needham a priority at our station. I'd also like to thank presenting sponsor Beth Israel Leahy Health and ambassador sponsor Petrini Corporation, as well as all of the event's generous sponsors. Producing tonight's program was no easy feat and would not have been possible without the commitment and expertise of the event committee. Thank you so very much for your time and efforts. I am a proud Needham resident and now more than ever so thankful to have access to world-class care in my hometown. During these uncertain times, one thing has remained unchanged. BID Needham is here for me, you, and our community. Let's be real, COVID is terrifying. It is a threat to our lives and our way of life, causing unimaginable loss, isolation, and disruption. But tonight, we want to focus on the silver linings, the moments of humanity that provided light in the darkest of days, the selflessness and courage that we witnessed, and the strength that we gave one another. Over the past 9 months, as the co-anchor of Chronicle, I've been honored to share stories of those affected by COVID, patients, families, local business owners, and frontline caregivers. Tonight, we will introduce you to one special patient, Mr. Jim Tremble of Medway, who was hospitalized at BID Needham as well as at Beth Israel Deaconess Medical Center for over a month. Through Jim's treatment and recovery, we'll learn how this disease impacted not only him, but his family and his care team. We will also hear some powerful messages from the frontline staff at BID Needham on their experiences. And of course, because a BID Needham event is not complete without it, a fantastic auction and an exciting raffle, both of which are hosted online. To participate, please visit the website on the screen or follow the link you received on your smartphone. The need has never been greater. This evening benefits the BID Needham Healthcare Heroes Fund, a fund that was created at the beginning of the pandemic to provide critical resources directly to our hometown healthcare heroes at BID Needham. We are grateful for participation at any level. Now I'd like to turn it over to John Fogarty, president of Beth Israel Deaconess Hospital, Needham.
Good evening, everyone. My name is John Fogarty, president of BID Needham. Tonight marks 22 years of the hospital and community coming together in an evening of celebration with one common goal: to strengthen and recognize quality health care at BID Needham. This evening, albeit virtual, will be no exception. I'd like to take the time to thank presenting sponsor Beth Israel Lahey Health and media sponsor WCVB Channel 5. I'd also like to express my gratitude to Steve Vinorni, Chair of the Board of Trustees, and Samantha Trotman-Berman, Chair of the Board of Advisors, as well as the dedicated member of both boards. I'm proud to be part of this team. And a big shout out to the Events Committee. It goes without saying that this year is one like no other, and they have once again stepped up to the plate, ensuring our annual event is a success. Over the years, you have invested in us to expand our physical footprint and grow our services. Because of that, in March of 2020, when the COVID pandemic forced the world, the country, and Massachusetts into a state of emergency, we were prepared to handle the challenges presented to us. During this pandemic, I witnessed firsthand the employees of BID Needham go beyond whatever we thought was possible. Our physicians and staff were called upon in extraordinary ways, and each time they rose to the challenge. When they were tested and tired, they didn't have to look too far for inspiration. That's because outside the hospital, the community organized quickly and raised over $500,000 in gifts, meals, restaurant gift cards, sneakers, and cash to support our employees through our Healthcare Heroes Fund. We were able to provide 147 grants to employees across 29 departments. $130,000 was awarded in grocery assistance, $37,000 in child care, $9,000 in transportation, and $2,000 in housing. With intention, we depleted the grants with meals and support to our employees during the height of the pandemic. But now our work continues. Immediately following the pandemic, in late June, Norwood Hospital, an institution that sees over 40,000 emergency room visits annually with 150 inpatient beds and 60 psychiatric beds, flooded and closed overnight, instantly displacing thousands of patients. Again, our frontline staff rose to the challenge to meet critical needs without advance warning. COVID is still here. And as we prepare for a resurgence and the possibility of Norwood Hospital remaining closed through 2021, we have to take care of those who took care of us. So tonight, we come together again, the hospital and the community, to support our team, our healthcare heroes who show up every day day in and day out to take care of our patients and each other in incredible ways. Their compassion, bravery, skill, and determination is on display for their patients and their colleagues. Shortly, you'll hear from many of them directly, and I hope you'll consider supporting them through a gift to the Healthcare Heroes Fund. Together, we are stronger. And now I have the great pleasure of introducing Dr. Kevin Tabb, CEO of Beth Israel Lahey Health, who would like to share a few remarks.
Hello, everybody. For those of you who don't know me yet, I'm Kevin Tabb, CEO of Beth Israel Lahey Health. I want to thank each of you for making time this evening to join us. I know this event is a special one each year in Needham and the surrounding communities. And this year, your support through the annual gala is more important than ever before. You know, BID Needham plays an important role within Beth Israel Lahey Health. It's a 58-bed hospital that's long been the standard for the community hospital model, staffed by the area's finest clinicians and staff, and provides access to world-class health care for patients that are closer to their homes. BID Needham's grown into a thriving regional destination for the highest quality care, and it's really become part of our lives, and it's helped so many of our family members, neighbors, friends who are watching tonight. Over the past several months, we've faced and will continue to face enormous challenges as individuals, as an organization, and as a community. The pandemic's put an inordinate amount of pressure on all of us. But despite that pressure, we've seen the best parts of people emerge in incredible ways. During this time, BID Needham has defined stronger together. An important part of the local response to the pandemic, the hospital staff really mobilized quickly and worked together with colleagues from across our entire organization to do things like increase bed capacity, to expand access to testing, and to secure PPE in incredibly short order. The work of the BID Needham caregivers, together with colleagues at all of our 13 partner institutions, was integral to the successful healthcare response across all of Eastern Massachusetts during the initial surge. We also witnessed the heroism and bravery of our patients and their families, and I remain grateful that we have institutions like BID Needham that are there to help our patients through what is, for many, the most difficult time in their lives. I know that our collective strength of spirit, the dedication of our frontline caregivers, and the trust of our patients will help carry us through whatever comes next to the brighter days that are just ahead. I know that we're stronger when we work together. Now, more than ever, we need to ensure the continued strength of our community hospitals and to carry on with our mission to provide each of you with the best possible care close to home. I want to extend my heartfelt thanks to all of you for supporting BID Needham, and I hope you enjoy the rest of your evening.
Thank you, Kevin. As Dr. Tabb touched on, our Beth Israel Lahey Health family worked together and leaned on each other in new ways to create a robust response across Eastern Massachusetts. There were many organizations and people who were an integral part of our efforts to fight COVID. We collaborated closely with town and state representatives, first responders like police and fire and local EMS teams, and our local state public health departments to mount our community response. And we witnessed the same tremendous effort from our community. The support, donations of personal protective equipment and supplies began pouring in almost immediately since the beginning of the pandemic. We saw signs with uplifting messages, parades, and our staff has been the grateful recipients of many meals, gifts, greeting cards filled with uplifting thoughts. The road has not been easy, but with your support, the outstanding team at BID Needham has continued on, treating and caring and learning from each other and our patients. Tonight, we want to celebrate all that we have achieved together, knowing that we have a lot more work ahead. But I know that this community and this hospital are stronger together when we stand side by side to respond to what may be one of the greatest challenges of our lives. Now I want to introduce you to Jim Tremble, his family, and a team of caregivers. Jim's story is remarkable, and his care and recovery was the result of more than 60 physicians, intensivists, surgeons, nurses, pharmacists, anesthesiologists, physical therapists, nutritionists, and administrative staff working together across the organization.
The woods are lovely, dark and deep, but I have promises to keep and miles to go before I sleep. And miles to go before I sleep.
And he said, whatever you have to do, I want to survive. I have a lot to live for.
The new case confirmed in Boston, and word now that the coronavirus death toll rising.
U.S. officials declaring a public health emergency.
As most states struggle to meet demand, doctors are already battling to save lives.
I can remember leading up to when I got sick. I can remember going to Atrius Health in Norwood to have the test. Lynn will tell you the test came back positive.
Dr. Kirstein called and she said, take him to the ER, Beth Israel in Needham. I couldn't go in with them, and that was the last I saw of him.
For 52 days.
For 52 days.
The care of Mr. Tremble was one of the challenging cases that we would frequently have in the intensive care unit, where the patient's virus was so advanced and so serious that they were put on a ventilator and they required days of care in the intensive care unit.
He went from ICU back to the floor, back to ICU, so he required a lot of hands-on treatment and ongoing analysis.
He was the sickest patient by far in our unit that we had been caring for.
It was really nerve-wracking, I think, knowing his background of lung cancer and going through treatments. When we got the news that he had been placed on a ventilator, it was, a whole different world.
I don't think I fully realized what was going on. You're frightened that you might not be able to get better. And I would cry at times because it just would overcome you. Will I ever get better? Will this ever end?
In the beginning, it was understanding what we had to do. Even the care of the patient would change from week to week. The staff were fearless. They took amazing care of the patients. They treated every patient like a family member. The patients came first.
I would talk to the nurses in the morning. Laura would talk to the doctor in the afternoon, and that person would give us, an update on his condition. They were very patient answering questions.
Mrs. Tremble would call frequently, obviously, looking for updates. So a lot of times I try to assure her that he's in very good hands.
One of the things that the nurses did was they would get the iPads for us and let us talk to him and kind of cheer him on and tell him he was doing great and, you're making improvements.
And the doctors and the nurses were so wonderful about that.
I think when we put together the team, there were 50 people involved in his care. And this was every shift. This team would meet, discuss his case to ensure that he was stable and he was on the road to recovery. And it was a wonderful success story. It made it all worth it. And everybody involved in the team were thrilled to know that he was a survivor.
I remember the ambulance people came and they rolled me out of the room and everybody was lined up. I was amazed. I didn't think that was going to happen. There's no doubt in my mind that Beth Israel, Deaconess in Needham saved my life. I want to thank you all for caring for me, not in just the physical sense, but in the emotional sense. How kind and gentle you were on my darkest days. I'm very lucky to be here, and I want you to know I realize it each and every day. I don't take it for granted. Thank you.
The parade was impressive. They had police directing traffic. It was so big.
I was just astounded at how many people went by.
We just want to continue on with having our family, having holidays, and hopefully, if everybody's safe, we'll be over this sooner than later, and we can continue on with our lives as we know them.
We're so happy to see Jim on the road to recovery. Jim and his family are like many others who have experienced the devastating and isolating impacts of COVID. It is inspiring to see the work of the caregivers at BID Needham to make patients like Jim feel less alone and treat them like they were part of their own family. In these difficult times, it is a relief for so many to know that in our community, we have access to the highest level of health care close to home. The front line of care here in Needham is also the last line of defense against the pandemic. The caregivers at BID Needham need our support to be able to continue the high level of care that our hometown hospital is known for. Please consider supporting them through a gift to the Healthcare Heroes Fund. Healthcare workers across the nation and the world often face great hardships just to show up to work each day. At this time, I'd like to introduce you to some more of the staff at BID Needham. Let's hear their stories.
At the beginning of the pandemic, I think the overriding feeling was confusion. One of the most important things that I think we did to start off was we formed the Healthcare Heroes Fund. When we started the program and the applications for the fund started coming in, someone said, "You've got to read one of these." You know, people were living paycheck to paycheck. The support was immediate and substantial, and I just thought that was a really great thing.
From the beginning, the word heroes was probably the best word because we didn't know what the virus would do. We knew they'd come into the emergency room. All they told us was, I've had a cough, haven't felt well for a few days. 3 hours later, they were intubated in the ICU.
I can tell you when COVID started, it was not easy. It was fast, it was hectic, it was chaos.
And it became tough and stressful. We didn't know what to do, who to mask, when, personally, what PPE we had to use.
You're going into a room, you try to spend as little time as possible in there, get what you need to get done, and then get out. You didn't have that time to spend and talk with a patient.
It became very tricky to sort of dice apart who needs what when the pathology is all similar and we don't know enough about it. We don't know who qualifies for what drug, what treatment. So it was really hard to answer questions for people when we don't know the answers. I think that was a huge challenge for many of us.
You know, it's easy to get overwhelmed because it was an onslaught. It kept coming. A lot of my colleagues were living in either separate rooms or they sent their families away, so adding to the isolation.
I couldn't stay without my kids for their sanity, for my sanity. We tried to keep it as safe as possible. Some nights, if I saw a lot of COVID patients, I had dinner alone, just so I'm not near all of them and exposing them.
My children, in the very beginning, you know, they didn't want to embrace me when I came through the door. So after I had been there, sort of showered, that kind of thing.
Also, I think some of it was seeing the suffering of the patients. They were alone, no family, no one to be there for them.
The process of just having to explain to people what was going on, they couldn't have any visitors, they couldn't have any friends. It was a very anxiety-provoking time for patients and their families.
During COVID, every single door had to be shut. We couldn't see any patients, and that was the hardest part, is we couldn't tell if they were safe. We would hear the alarm going off, and we couldn't get to them fast enough because we would have to protect ourselves. We'd have to put in, you know, the full PPE. It was a hard thing because normally we can see all of our patients all the time, and this was hard.
They would put the patients on the monitor when they knew they were dying, and the nurses would go in and hold their hand. Their families couldn't, well, I shouldn't have got emotional. I haven't done this yet.
BID Needham has become a different hospital as a result of what has happened in 2020. We would not have gotten through this pandemic without the amazing support of the community.
Restaurants in the community, they actually donated to the hospital, which was great. You know you had a healthy meal to get you through the day. That extra focus was towards our patients, not worried about where our next meal is going to come from.
We were told that New Balance was going to donate sneakers.
We were given shoes so that we had safe sneakers to wear around the hospital and not have to bring those things home.
The little rocks that line the hospital, I think that was just touching to a lot of people.
Each rock had an individual message like, we're proud of you, keep going. Some just had hearts on them, and I just took my time and walked along and read them, and it was really inspiring.
When I had to leave my little baby at home in the morning, coming into work and seeing, you know, the things that people have left, leaving work, to little kids clapping out in the parking lot, just knowing that people actually appreciated what we were doing, it meant a lot.
The community, the board, the calls we got, the parades that went by, that brought joy to the staff. I would say in my career, the most amazing and rewarding experience of my life.
We established our Healthcare Heroes Fund. Everything in that fund will go back to our employees. Any employee who is having any kind of hardship right now, they can apply to this Healthcare Heroes Fund and then receive a grant up to $500 a month to help with their expenses.
I still had to keep paying for daycare, even though my son wasn't going, and paying somebody at home to watch him. Just knowing that I had that little extra income coming in was one less worry that I had to worry about. It was a huge sense of support and knowing that people cared.
We need the continued support because COVID is on the rise again, and it's a huge morale booster. People go 12 hours without even having like 10 minutes to sit. It's just constant. So that show of support is huge.
The work is not done. We're going to need continued support going forward, but everybody should know is that your local hospital is better, stronger, and prepared for a successful future in 2021 and beyond.
Thank you to all who shared their story. Tonight is about celebrating their efforts, the work of their colleagues, and the community. The need to support our healthcare heroes still exists, and there is more work ahead. But as we've seen tonight, there are many people out there who are doing all they can do to care for you and your family. If you would like to support their efforts, please consider making a gift. Every single dollar counts, and gifts of all amounts are greatly appreciated. You can see just how your contribution can make a difference. To make a gift, please visit the website on the screen or follow the link sent to your smartphone. On behalf of the healthcare heroes and everyone at BID Needham, thank you for your generosity and support. It has been such a privilege to share these stories with you, and I hope that you found them as moving as I did. Right in the heart of Needham is a hospital that is both filled and surrounded by inspiring people, caregivers, staff, patients, families, and neighbors who, in the face of uncertainty and oftentimes fear, made sacrifices and found the strength and support in each other. It gives us hope knowing that together we are stronger, together we can fight this disease, and together we will see a brighter future.